Dr. Gary.
Thank you so much, and good early afternoon from Finland. It's a bit earlier here than in India, but it's been a very, very interesting morning and early afternoon for me as well. And as said and presented, I'm gonna talk about what we did in terms of Finland, Europe, and actually altogether 9 different countries throughout the world during COVID, and how we were actually able to help in terms of critical care by utilizing a critical communication platform called Secapp. But before going into the specifics of my presentation, of course, I want to extend my deepest gratitude and thanks to all the first responders, doctors, nurses, volunteers, and of course, all of you medical equipment manufacturers for actually helping to fight against COVID. Your input is invaluable. So it's very impressive to see what you've done so far. And of course, big thanks to the organizer of this webinar as well. It's a pleasure to learn from each other and share our experiences, and of course take those the best practices into use in different regions. A few words about my background. I've been working in technology and especially in communications for quite some time already, and my special focus has been on kind of a future communications of space as well as mobile. And for the past 10 years, I've been part of building Secapp. So I was one of the co-founders of it, and currently as a CEO of it. And here's a quick picture and quick facts of our team. If we are looking at Secapp, of course, the key thing is for us to be able to help in terms of technology, medical professionals, for instance, to, in this case, to fight against COVID and react into it. In terms of our company, we've been in a good situation as such, because we already had a good presence in terms of the medical sector earlier, but throughout the COVID, Secapp has been adopted in various different regions and taken into a much wider use, and that result has seen in growth numbers of over 63% during the spring alone. We've got a few very good awards throughout the years, and related to COVID, European Commission has mentioned us as one of the technologies that can actually help to fight against the virus. And of course, we've managed to form partnership with very esteemed companies throughout the years, listing Airbus, Defense and Space, large telecom operators like Saudi Telecom Company, and so forth. But towards what we've done in practice for the fight against COVID, and if we are first, let me introduce you a few background details about Finland. So Finland is not as big country as India, for instance, but it's very technology advanced country with 5 million people. And related to COVID, what we've actually managed to do here is that we've got only 300 deaths. So the number is fairly low. For instance, if we compare that against our neighboring country, Sweden, where the numbers are even 10 times higher than in Finland. And one of the key factors for actually being able to do that is to utilize, of course, the quality of our healthcare, but also to be able to utilize technology and equipment in a way that allows us to actually react and make educated decisions. And there are three topics that I'm going to highlight from that perspective. One of which is, of course, how we are prepared to these kind of situations and how we can actually improve the preparedness throughout the crisis as well. Even though we've had previous experiences of SARS or swine flu and so forth, but I still think that the magnitude of COVID got us all surprised, and we really not needed to start reacting into it. So I'm gonna touch upon that a bit. So how you can actually improve the preparedness and work on that. Another other topic there is kind of related to the professionals and shortage of them. So because a lot of doctors, a lot of nurses and so forth working in the medical industry are in very high demand. So how we can actually facilitate that, we can coordinate those people better, how we can make sure that we reach the right individuals when needed, and how we can actually coordinate that even between hospitals or between regions, so that we can provide the best possible medical care when needed. And the final thing is of course, it's not all about just having the information and the communication between people, but we also need a lot of critical data. So what are the amount of infected people? What's the situation in terms of protective gear? What's the capacity of the intensive care units and trauma units and so forth, so that we actually can make the educated decisions to react to these situations. And how we've done that with Secapp. So if we're starting from the topic of being prepared, one of the key problems that we started to identify very early on was that a lot of misinformation was being kind of even shared among the medical professionals, and having thousands and thousands of people working in the industry, it was very parallel that we actually have tools to reach those individuals and provide them official information what to do. So provide mass notifications to the people that, all right, we've got this outbreak ongoing, what you need to do in it. This is the official instructions, what you need to do. And of course, the key thing, even though we are seeing on the left-hand side a video about the application, is that we don't just rely on the application. We need to be able to reach individuals using any device that they have in use. So from a single point, you can send out the information to the application, but you can send it out to an older phone, you can send it to a laptop, you can send it to any device. So that way you can take control of providing the official guidelines, the official information, what to do in this given situation. That improves the preparedness a lot. The second topic, what I mentioned about the coordination of resources, that is of course very important. Being able to have the information about the professionals of course within the hospital itself, but also through between different hospitals. So where you have doctors with the special skills, where you have the nurses with given information, when you need to actually reach them, making sure that again they notice that, all right, we are needing more doctors to the hospitals. We need the doctor to come to the ER, or we need more nurses to come to the hospital, and so forth. So kind of what we've done there is that we built kind of a digital pager type of thing. So you can send out the paging information that we are needing these people right now, and it takes just a second to do that. And it demands instant response. So you've got immediate knowledge who can actually respond to any given situation. And what I mentioned is it's not all about coordinating the information to people and coordinating the human resources, but also coordinating the information and data related to the situation. So the key thing is that you have centralized data about all of the hospitals, all of the medical facilities that are working towards the mitigating the effects of COVID. And what we did there is that every single day, an automated message is sent to all of these units, and it only takes a minute for them to fill out the information that how many COVID patients they have, what's the situation in terms of the equipment, what's the situation of the adequacy of protective gear, do they have enough respirators, what's the situation in terms of hospital beds and so forth. And as it takes just a minute to fill it out, they were managed to roll out that throughout the country, and they get information daily about the current status, and they can start make educated decisions to coordinate these resources and additional equipment and so forth to correct places. And the end results are very good, because the Ministry of Health and the actions based on this data has led to a situation that the increase or the spreading of the virus has stopped. And we are in a situation that the numbers are very good in terms of actually stopping at least the first wave of COVID in Finland. Some of the other aspects, what has actually led to us being able to get this as a nationwide solution in Finland and in other countries as well, is that it's very easy to take into use. It's just a few hours and it's in use, and you can start working from that. And it just takes very simple steps. You just tell who is going to be using it. You go through a quick online training. It works as a service with any device, and of course the security is a key thing there that you can actually highlight and make sure that the data that you collect and the communication that you do is secured and not being used to any other purpose than your own. Of course, some other highlights are that it can be integrated to other systems, so it's not replacing existing methods, but as I say, it works with any device, and it can work alongside with other devices and systems as well. And finally, if we have some time left, I can share a 2-minute video, but what's the situation in terms of time? Do we have time for 2 minutes? All right, let's go with that. So a quick intro how Secapp works. So this kind of underlines the problems that I mentioned. So lack of skilled personnel, being able, how we can actually dispatch those personnel to targeted areas where we need them, how we can communicate with any device. Basically, we can send it out very easily. People can receive that, they can respond to it immediately. And of course, the end result is that we can react into it. And again, about the critical data that we just went through, sending out that kind of a digital form that you fill out every day, and it takes just a minute to do that. It's a very good way to do it, to collect the information easily, and then of course you can analyze the data in the system. Point of view. that was a quick video about Secapp, and I hope that you got a brief introduction on what we've been doing from our company side, and of course what we've done also in terms of Finland and how we've fought against COVID so far. And thank you for your time and interest.